we'll get started.
Okay. Hello, everybody. We were just going to kind of kick things off by introducing Backpack Health for those of you who don't know us yet. But we're going to be working with Tammy and EDS Wisconsin to help provide the community with an app that will help you guys track all the details of your health. And then at the same time, we're creating a group environment for EDS Wisconsin where Tammy will be able to, and others in the EDS Wisconsin group will be able to provide resources through the app. They'll be able to ask questions so that they can gather information and really start to see the trends going on within the community and share that with you guys. So just kind of wanted to let you know that that's coming up, and we're going to follow up this with other webinars to show you the product itself once we have the group live. But if you have any questions, you can always reach out to us. Thank you.
Thank you. And I'll be going over Backpack Health a little bit more during my presentation. So my name is Tammy Kosbab, and most of you have heard about Mast Cell Activation disorder, but isn't it confusing? What is it? How is it related to EDS? Well, today I'm here to help you to learn about mast cell activation, how it might relate to EDS. And since I'm not a medical professional, I cannot share with you, give you recommendations or give you advice. But what I can do is I can share my symptoms, my journey, what I've been through, how mast cell activation has affected me, and what I'm doing for treatment options.
Tammy, I'm sorry I have to interrupt you.
Yep.
We are only seeing the slide. I believe your screen is being shared.
Yep. Yep. Yeah, you can just see that front slide.
Okay.
And so she's going to go through the slides. She's going to have this, we're going to be able to see her PowerPoint. And that's what she wants, is the main screen.
You don't want us to see you?
No.
Not yet.
Okay. Thank you.
Although if you press escape, you'll be able to see the presentation, and then up top there will be a banner with everyone's video feeds if you'd like.
Okay, thank you.
Yep.
Okay. So the reason I'm here is because I want to help you to feel more successful and in control of your health and your body. Since I'm not a medical professional, if you have questions for me that we're going to save questions for at the end, you're going to have to ask me questions in relation to me, such as, have you experienced this symptom, or what have you done in this situation? I hope by the end of this presentation, I will have helped you to learn more about mast cell activation so that you can understand it, how it's affecting, how it could be affecting you, and what you can do about it. Did you know that mast cells can be found in every organ in the body? Here's our agenda. First, I wanted to thank Burkhart Physical Therapy in La Crosse for hosting the group at their location, and Backpack Health, who has helped us with Zoom. I'm going to give Burkhart, Myra Burkhart at Burkhart Physical Therapy, a minute to talk right after this, just to introduce herself, because she actually really pushed to help EDS Wisconsin in the La Crosse area. Her company, I'll let her tell you, but her business, they offer a lot of therapies that can help people with EDS, things that may not be available at a normal physical therapy organization. Then I'm just going to talk about my journey, symptoms, Occams razor, what is a mast cell mediators, receptors, symptoms again, because once you understand the mast cell and then you look back at the symptoms, it might make a little bit more sense. Triggers, diagnoses, treatments, what to do in an emergency situation. And then I wanted to quickly talk about drug metabolism, and then we'll have questions. So, Myra, are we able to share your screen? Do you have any slides for us?
Okay, hi. I do not have any slides.
Okay.
And you can hear me?
Yep.
Okay. My name is Myra Burkhart. I founded Burkhart Physical Therapy Center in 2001. And since then, I now have 6 therapists that are all trained in the same techniques. I developed my clinic just by treating patients who had failed other clinics and creating a niche. Most of our therapists are certified experts in the techniques that we use. So how we are different as a physical therapy clinic, we see our patients for 60 minutes. We focus on listening and on hands-on techniques. We listen with our ears, our mind, our heart, and our hands. With our hands, we facilitate healing based on each individual's presentation. Our strategies that we use that are most beneficial for our EDS population and that you should look for in your area if you're not in my area in West Salem, Wisconsin, are fascial counterstrain and Jones counterstrain. Dry needling technique has been very helpful. We are certified through myopain seminars. If you can find a therapist who's certified through myopain seminars, it is the highest level of expertise in dry needling that I know of. Muscle energy technique, Michigan State muscle energy technique would be what you'd want to ask for. Kinesiotaping has been very helpful. All my therapists know how to kinesiotape. And we do more than just exercise, we do movement training and joint protection using primarily Shirley Sarman principles, and that's S-A-H-R-M-A-N. And if a therapist has been educated in this principle, they would know it. We educate lifestyle balance as it pertains to getting enough rest, sleeping hygiene, nutrition, activity pacing, and modifications. And that's just in a nutshell what we do that's different at Burkhart Physical Therapy. And those, I just gave you some names of techniques that you should be asking for if you're going to physical therapy. That's about it. So thank you for giving me the time to speak.
Thank you, Myra, and thank you for everything. Thanks for letting the group meet in lacrosse because you're helping a lot of people. We really appreciate it.
You're welcome.
And your website, we actually have a page set up on our website that has a link to Burkhart Physical Therapy and Backpack Health. So we'll start the presentation. So my journey. When I was a baby, I was colicky. I was probably like a parent's nightmare. My parents had to drive me around to get me to sleep. I was a big baby. I was not able to drink any normal formula. I mean, it was always one thing after another when I was a baby. During my school years, I had headaches, stomach aches constantly during school, but because this is something that I normally experience in my life, it was normal. Like, I didn't know that other people didn't have headaches. I didn't know that the lights in the school were bothering me. I didn't know that eating lunch was what was probably causing me to be tired in the afternoon. My entire life, I've had dry, itchy skin, constant indigestion. It was just something that was completely normal to me. I didn't know anything different. Irritable bowel syndrome, so tiredness, problems with my memory, ADHD symptoms, not able to concentrate. I was anemic off and on throughout my life. And then when I hit puberty, everything got worse. And this seems to be a common theme with a lot of the young females who have EDS and mast cell activation. And of course, we think this is normal because this runs in our family. It happens with our parents, it happens with our grandparents. So nobody thinks that, well, life could be any different. In 2009, I was diagnosed with what was formerly called type 2 EDS, so it was called mild classical type. So I was kind of relieved then that I found out that I had EDS, and I knew what was causing my symptoms and my pain, and thinking things were going to get better. But unfortunately, things didn't get better. I still had pain, I still had stomach pain, I still had headaches. And it's like, even though I had this diagnosis, there wasn't really an answer to what was actually causing all of the other things. In 2014, I moved to Forest Lane in Rhinelander. We lived on 5 acres in the middle of a forest. There was literally trees everywhere. And at that house, we had a dog and 2 cats. Soon after I moved there, I was not able to eat again. So when I hit puberty, apparently everybody thought that I was bulimic or anorexic, because right when I hit puberty, right around that age, I was like around 12, I was throwing up all the time. Like, I could throw up water. It didn't matter what it was. So then now, fast forward, 2014, all of a sudden after I had moved, and I didn't know that all this was related, except for the doctors saying that, possibly it's in my head. Like, you're stressed because you moved and blah, blah, blah. So now you're having problems eating and wanting to blame it on that. I was finally diagnosed with pharyngoesophageal dysmotility. So what that is where all the little muscles in your esophagus don't actually work together to move your food down your esophagus into your stomach. Mine are going up or sideways and all these different directions. So when I swallow food, it doesn't actually get to my stomach all the time. Sometimes it does. Between 2014 and 2015, I lost a lot of weight. People were really starting to get worried about me. The ER doctor got to know me really good because I was there. She noticed that I was there every 4 weeks. And the reason I was there is because I was having swelling in my throat, my face, trouble breathing, throwing up, cyclic vomiting kind of symptoms. But then she noticed after several months that it had been 4 weeks every time I was there, and she thought maybe it could be related to my menstrual cycle. Well, I think it was in 2016, I wanted to go to the EDS conference because I was so desperate. I was writing letters to TV shows and the doctors and wherever I could think of, because, a lot of us are in this situation. What is going on? This seems really serious. We can't eat. We can't sleep. All these things are happening, and nobody has, a reason except for to say that it's in our head. And we know that it's not in our head. So I was still fatigued, even though I had my diagnosis of EDS, still in pain. I knew that there was answers. I did not want to live like this anymore. So when I was at the conference, that was the first time I had heard the incredible Dr. Ann Maitland speak. Dr. Ann Maitland is an allergist immunologist in New York. She studies mast cell activation, and she has done so many talks around the country. She really wants to help people to understand mast cell activation, what there is to know about mast cell activation. Thankfully, after I came back from the conference, I was able to find a mast cell activation knowledgeable doctor in 2016, and I was diagnosed with mast cell activation disorder in 2016. So here are some common diagnoses, signs, and symptoms for persons who have EDS. I know for myself, even now, because not that you can't go back and get things removed from your record, but the mast cell activation really can override a lot of these diagnoses that I have in my chart. Do you guys have these in your charts? I mean, there's even more than this. And wouldn't it make sense if these conditions came from one source versus, you know, like, it doesn't make a lot of sense that we have this disease and this disorder and this syndrome and that. Like, how does that make any sense? It would make a lot more sense if we just had, if there was one reason for all of these things. What is Occam's razor? The definition of Occam's razor: the simplest of competing theories being preferred to the more complex, or that explanations of unknown phenomena be sought first in terms of known quantities. So there's a book called Never Bet Against Occam that was written by Dr. Lawrence Afrin in 2016. And after I got back home from the presentation from seeing Dr. Maitland, I got that book. And in that book, I highly recommend it because the book is about 600 pages, about 700 maybe. Half of the book is full of terminology. The other half of the book is divided in sections by body system and how mast cells can affect different body systems. But I really learned a lot from that book. And we actually do have a couple copies through ES Wisconsin. So send me an email if you wanted to get on the list to rent those out. So again, mast cells can be found in every organ in your body. Imagine that. This is a slide from Dr. Maitland, and I actually used several of her slides. She sent them to Dr. Bluestein and I after the conference because I was able to speak with Dr. Maitland at that first event in 2016. I saw her again in 2017, 2018. In 2017, we actually went through helping a patient who was having severe symptoms at the conference in Vegas. And so I got to spend some time with her. And we also ran into her at Walgreens, which was super cool. So I was with Dr. Bluestein. And we got to walk around Las Vegas with Dr. Maitland and talk. I mean, it was great. She is wonderful, wonderful, knowledgeable person. So this is her slide, and I do have them marked. So mast cells are found in most parts of the body, and they're known for their role in allergic reactions. And you can read this too. So the mast cells have, the mast cell itself contain, that's what this is here. The outside container would be the mast cell, and inside of the mast cell, there are all these different mediators. This says that there are over 500 secretory granules and mediators that get released. So degranulation refers to the process of when you come into contact with an allergen, the mast cell falls apart and releases these mediators. This might actually be a good time to show you our fun little project here. So I really wanted to show how this can affect us. And it might be a little bit difficult to understand right now, but hopefully this can help you. So when we someone who's allergic to strawberries and has anaphylaxis, so the purpose of the mast cells is to save our lives. So, you know, strawberries might kill us. So a person who has an allergy to strawberries or peanuts or something like that comes in contact with them. So then your mast cells like, whoa, and here it goes and dumps all these mediators into your system. Remember, there's 200 to 500 different mediators. So we got histamines, which are all the orange ones. This one here is a lipid mediator. This one here is a prostaglandin. This one here is tryptase. heparin, all kinds of things that are released by this. IL-4, interleukin-4. So what happens when all those mediators are released is they travel through your whole body. They're in your bloodstream. But what they especially do is this is anaphylaxis. This here symbolizes where these mediators are traveling through your body, and they're actually going to make your throat swell so that the strawberries can't get into your body. It's going to speed up your heart because your adrenaline's being released in your body. And it's also going to trigger things in your stomach so that if the strawberry or whatever toxic substance is going into your body actually were to get to your stomach, that your body wouldn't digest it so that it wouldn't kill you. So, does that kind of make sense? All right. We know what anaphylaxis is. So the normal mast cell response, mast cells contain the mediators that keep out intruders. Like I said, if there's bad food, it's going to swell the throat, swell your stomach so you don't digest. And also IBS symptoms are, for me, it's my body overreacting and wanting to get rid of whatever's in my digestive tract because it thinks that it's bad for me. So IBS is like sudden urge that you have to have a bowel movement like immediately. And so that is like a really fast evacuation. Insect bite, you'll get redness and swelling at the area, and that prevents the venom from entering your body. Same thing with like itching. You know, they're all innate responses that are intended to save us from all these things that are supposedly going to kill us. The mast cells use anatomic barriers to keep things out. So there's the GI tract, the respiratory tract, the urogenital tract. All of those things will swell and try to get rid of. They'll get irritable. They also use inflammation, redness, swelling, heat, and pain. All of those things are intended to keep toxins out. Here's a slide from Dr. Maitland, and I really love this slide because this shows mast cell activators. So the mast cells can release all of these chemicals, like we had already talked about, and they can affect all of these body systems. And, you know, again, that's what this is showing. We have all of these receptors in our body that can be affected when these mediators are released into our body. Histamine. Histamine has been proven to be one of the most powerful vasodilators. So vasodilator would be something that is making your blood vessels dilate. So what happens when your blood vessels dilate is that they're more permeable, and people have swelling. So if you're having an allergic reaction, your throat swells up, that's because your blood vessels are more permeable, swelling, the water is coming out of that tissue in your throat so that nothing can get down. So, you know, that also happens, you know, in people's face and other areas of their body. Because these histamines are traveling through your whole body. I mean, that's what we have to remember, is that all these mediators, they're in your bloodstream, connecting to where the receptor sites are. So again, this is showing all of the different things, all of the different body systems that can be affected by the mediators. That look familiar? 70% of reactions involve the airway, throat tightening, throat swelling, nasal congestion, nose, rhinorrhea, wheezing, dyspnea, which is trouble breathing, chest tightness. 30 to 45% involve the GI tract. So if you're having a reaction, can you see your stomach? Can you see your esophagus? Can you see your intestines? Can you see that? I mean, you know, when we go in, you know, what the normal ER doctor is looking for is hives and swelling. Well, what if we don't have hives and swelling? What if it's on the inside? So now, going back to common diagnoses, signs, and symptoms, I mean, do these things make a lot more sense as to how they could be related to mast cell activation and those mediators being released in your body? So the next thing that I want to do here, make sure that everything works right. Listen. You should stand up and watch what you're doing. Okay. So my son was going to be here, but then he decided he didn't want to. So that's okay. I'm super excited that you guys are here. Like, I have been learning so much about this since 2016, and the treatments have been helping me. So, you know, I really hope that getting this information out there can help you to understand. I actually first heard about mast cell activation in 2012 at the EDS conference. And I was like, I remember like this table over here. And I'm like, well, yeah, I have allergies, but that's not my worst problem. Like, I'm having pain. Like, I need to deal with that. I need to deal with throwing up. You know, like, I'll just deal with that later. So, what I want to show you now is how mast cell activation is different than anaphylaxis. So, can somebody tell me something they did today? What did you eat for breakfast?
I woke up.
You woke up. We all did that, yes. What does that involve? That involves standing up, doesn't it? So some of the things that affect mast cells, one of them are pressure. So if you can imagine standing up and you're these cells here, and you're like this, all comfortable, and now all of a sudden you're like this. So this symbolizes pressure and standing up. These are like really. Whoa. All right. Here we go. We got some histamines going a little bit. Wow, check that out. Now we're going a little bit. And then what else? What else do you guys do today? Shower. Yes. I took a shower too. So mast cells are also affected by heat. Hot showers feel good. So the hotter the shower, the more you're going to be affecting these mast cells. I know for me, like standing and taking a hot shower, like, can really, really make me feel like crap. So now we're really going. What else? Does anyone have mold in their house, in their windows, in their basements? I have some mold that's starting in my window, one of my windows in the room. Mold can be a trigger. So just breathing, just being in your house, if you have mold, you can be triggered. There we go. Pet dander. All of these things are affecting, they're attaching to the receptor cells that are on the outside of the mast cell. So everything that we're doing over the course of the day is adding to this. So what can we do? Oh, this here, sickness, virus, bacteria, illness, anything like that, that can be a big trigger. So if you're sick, you're gonna feel worse. You're gonna have the red runny nose, which explains like, you know, why your face gets all red. Vomiting, you know, all those receptors in your stomach, you know, just want to expel and get everything out of your system. Another big one is menstrual cycle. Pretty much everybody that comes to meetings, and you know, we know EDS affects women more than men, but we also have a lot more hormonal changes going on in our bodies usually, and especially at puberty. We have so many girls that are needing help like right around the time of puberty. So hormones, something you can't even control, are going to affect your mast cells. And, you know, there's nothing you can do really about that. But then laughing, when you laugh, your body releases hormones. When you cry, your body releases hormones. When you get excited, your body releases hormones. When you sleep, your body releases hormones. I mean, how many people, I know a lot of people who have woken up, me being one of them, in the middle of the night having a panic attack for no reason. I don't get those anymore. So here we go, stress. And the reason I highlighted stress on here is because stress is really hard to control, and stress definitely releases hormones and can make our symptoms worse. That is why it's not that anyone's saying that it's in your head, but the more that you can find ways to keep yourself calm, meditation, breathing exercises, all of those kinds of things can help you to calm down your mast cell. So, mast cell activation syndrome. It's a collection of disorders characterized by accumulation of mast cells, any or all organs and tissues. So there's actually another condition called mastocytosis. Mastocytosis is a bunch of mast cells. So there's like too many mast cells in one area. Mast cell activation is when every little thing we do is like bumping this stuff out of our mast cells like all day long. And as you can see, like from all these receptor sites, like these are circulating through our body. And like the more things that we're doing, if we have the problematic mast cell, the more symptoms we're gonna have. And it might not even be right away, it might be the next day. So the proposed diagnostic criteria for mast cell activation disorder, it says proposed diagnostic criteria because as of the time of this presentation, there was not an actual diagnostic criteria. I do believe that there is now an ICD-10 code. So I had to have on file that I had signs and symptoms consistent with this condition that affect 2 or more of my organ systems. That's easy, probably for anybody listening to this. First thing that my doctor did was try me on increased doses of antihistamines. So what that did was they're taking, what he's looking for is, so this here, if you're having a headache, your mast cell is going around and it's trying to connect to these receptor sites. And what an H1 does is it connects to sites where the H1 receptors are, and block them. I don't know if you can see that, but it's an actual safety thing. And this one is Allegra. We're going to block it so that that can't be triggered. This one here, this is Singulair. Singulair is a blocker for mold. Mold affects your lungs, and actually, we're missing one for lungs. This is the heart. But thank you. People with mast cell activation, I mean, you can respond to, I can respond a little bit to one dose. So normal dose of Allegra, 180 milligram a day. That's what it says on the bottle. On the article that was released in March of 2017, EDS and mast cell activation disorder by, I can't say the name, it starts with an S, and then Maitland and Afrin all contributed to that. On page 8, the very last paragraph, it says that people with mast cell activation need 2 to 4 times of normal dosing. The other thing too is that this is supposed to be 24 hours, but it wears off. So if you're going to be taking, if I'm taking Allegra, and my mast cells are still like releasing all this stuff all day, and the more things I'm coming in contact, I mean, pretty soon, it's not going to be working anymore. So I actually have to take this. I have to take this 4 times a day because otherwise it doesn't work. I've heard of people who've told me that, well, I took like one Zyrtec and it didn't do anything for me. And that might kind of explain why. Another thing too is if I were to miss a dose, things will actually get worse. So it's kind of, I was told it was a snowball effect. So I have to continuously take these histamine blockers. So there's H1, there's also H2. This is one that goes in your stomach, famotidine or ranitidine. So that's one way that I treat my mast cell. So response to therapy. So he put me on the Allegra and famotidine. Actually, we started out with Zyrtec, which didn't help me very much, even at 4 times a day. And I also took ranitidine, which is also an H2. That didn't help me very much. I mean, we're all so different. One person might need Singulair, one person might need famotidine, one person might need ranitidine, one person might need all of them. I mean, it just depends on you and what you're being exposed to and what your triggers are. So another thing that they have here for the proposed diagnostic criteria is evidence of increased serum markers of mast cell activation. So what they're talking about is measuring these things in your blood or in your urine. There's a couple problems with that. The biggest problem is that histamines only stay in your blood for like 2 to 5 minutes. So unless you're at the lab and they have the appropriate equipment to test you immediately, it's probably not going to show up. Not everybody has elevated tryptase levels because not every reaction is going to release tryptase. Not every reaction is going to be IgE mediated. So IgE isn't always going to be elevated. So that's what really makes this really complex. So I've read one place where there's over 200 mediators or more. And I mean, we just don't have tests that can test for all of these mediators. And then not only that, but tryptase levels. So Dr. Maitland in her presentation had told us about somebody who she had treated, and anyone who knows about tryptase levels knows that what they're looking for is tryptase 15 or higher, I believe, roughly about there. This girl had a tryptase level of 6, and everybody told her that, you know, she couldn't have mast cell activation because her tryptase wasn't high enough. After the girl got better and she was getting treated, her tryptase went down to 2. Now we have the next person who comes in and they have no symptoms and their tryptase is at an 8. I mean, the science just isn't there yet. We have to really understand that doctors don't have this information. We can't go to them and say, hey, can you test me for mast cell activation? Because the science isn't there. The facts just aren't there yet. That doesn't mean that they're not going to be. Another really, really, really important thing is that knowing that mast cells are an innate function of our body, they're there to help us. We have to make sure, doctors need to make sure that nothing else is going on in your body. Do you have, these are actually some common ones that Dr. Maitland had shared with us. You know, we have to really, really make sure that we're not telling these cells to calm down if our body actually needs them to be functioning for us. Why is there a delay in diagnosis and treatment? I mean, that pretty much sounds like us, you know, with EDS. We're sent from this specialist to that specialist to that specialist, and everybody thinks that somebody else is going to figure it out. In an article in 2011, Diane Harding said that patients with mast cell activation syndrome frequently go years without an accurate diagnosis, but once diagnosed and treated, their response is likely to be excellent. This is one reason, one thing that we can be telling our doctors, our healthcare facilities, clinics, anyone that we can tell, you know, if you want to help save money, this would be one way to do it. Because if we're going to get better with treatment, I mean, famotidine, Allegra, like how much do those cost, really? So this slide actually lists a lot of conditions that mimic mast cell activation. I was really surprised to find out that Kunis syndrome is what Dr. Maitland said is an allergic heart attack. We have cardiovascular problems in my family. We've had people have heart attacks, more than one person have a heart attack in my family at 38 years old. So this here is talking about targeting the mediators and what mediators are released. So immediately, some certain mediators are released, and then over time, different mediators are released. Some of the treatments would be anti-IgE. The one that I can think of is Xolair. Histamine, blockade, tricyclic agents. It is theorized that some tricyclics actually help calm the mast cells in the brain. It's not a fact. It's really, there's so much more that needs to be done, more research. Corticosteroids and mast cell stabilizers. So one thing that we can do besides blocking these receptors with the H1 and the H2 is actually to make this here stronger. And those are called mast cell stabilizers. So, because we have hyperactive mast cells and they're constantly releasing these mediators, like over things that we do, we need that mast cell to be stronger so it stops releasing the mediators. So now when we're coming into contact with heat and things like that, it's not overflowing. Also, acupuncture is being looked at as treatment for mast cell activation, and it has to do with the signaling that's happening within the connective tissues. For me, my mast cell, the biggest thing for me, the biggest triggers are foods. If I have MSG, I know I'm going to be sick. Probably the next day. I am going to wake up with a headache. I am going to have indigestion. And that goes for other additives, preservatives, and food dyes. I also take Allegra and famotidine that block the receptors. I take Gastrocom, which is a mast cell stabilizer. That's normally prescribed for IBS. How funny is that? Like, when I take Gastrocom has to be, it's very, I have it right here. It's actually in metal. It's sensitive to light, it's sensitive to temperature. I have to take it every like 4 to 6 hours. Sometimes I can tell it wears off at like 3.5 hours. How do I know it wears off? Because all of a sudden I'm having symptoms. All of a sudden I'm getting a stomachache. All of a sudden I'm getting a headache. And then probably the biggest thing that happens to me that I know that it's worn off is I start getting heart palpitations. Does that make sense to you guys? I mean, so my mast cells are starting to, all the mediators are starting to attach to these things because the mediators start getting released. And then my body starts releasing adrenaline. That's what happens. Recently, I started taking a TNF receptor antagonist called Enbrel, and I actually think that's really helping me. TNF is also released from the mast cells. Another thing is reducing exposure. So if it's funny, every time I go to the doctor and they tell me like, oh, well, I just want to tell you, like, we just switched manufacturers because, you know, like, it's not a big deal. It's just going to look different. No. It is a big deal. I have a mast cell disorder, okay? Like, anything that you're going to add into my body could affect me. It's going to contribute to everything else. So now that's why I think it's so important that we're just aware of this. We might not be able to control that, and it may not affect us, but it's something that we just need to know about. Exercise and healthy foods. Anything that you can do to increase your circulation, increase your blood flow, all of those things are going to help your mast cells to be stronger. Here we go over the blocking the plugs, blocking the receptors. So there's first generation short-acting H1 blockers. They're not preferred as a first-line treatment. I've heard people telling me that they take Benadryl all the time. That is not preferred. Second generations are more preferred because they're longer lasting, and I was told that they work just as quickly. So I take Allegra, and it works just as quickly as if somebody was taking Benadryl, except for the Allegra is going to last me 24 hours. Benadryl is going to last 4-ish hours. I also take Benadryl as a backup. So if I'm on all my medications and I'm still having symptoms, especially the throat swelling, which is why it's been really serious for me, because for me, throat swelling, I mean, that's a pretty serious thing. And I get problems with my lungs and breathing and wheezing. The H2 receptors, antagonists, famotidine, Dr. Offren says that famotidine is 9 times stronger than ranitidine, and we also have to take higher than normal doses for those. But definitely, I definitely follow my doctor's guidelines with how much I can take. Mast cell stabilizers, Gastrocom is a prescription one, and it's actually very expensive. Quercetin is a over-the-counter supplement that is not that expensive. The thing, being that I have my degree in healthcare management, and I've studied this a little bit, I prefer, it sounds silly maybe, but I actually prefer when something has gone through extensive studies so that it's a prescription medication. Quercetin, I mean, if it hasn't gone through all those extensive studies, it makes me a little bit nervous to take it. I mean, I don't know, believe what you want, but that's kind of my opinion on that. There's also natural stabilizers for mast cells that are found in certain foods. There's other receptors here, possibly tricyclics. The other thing is that we always have to weigh the benefits of taking a medication with the risks. In an emergency, I have my information on an app called Backpack Health that he was talking about. With Backpack Health, I have my own website. I can actually just pull it up right here on my phone. Okay, so in an emergency, put it this way. Say I was alone and say I was in a car accident or something, and now all this pressure and trauma and I'm having a reaction. How do you explain mast cell activation? So with Backpack Health, I get my own website. I can put my website on my medical bracelet or necklace or tattoo, whatever you want to do. And emergency personnel can go to my website, and it also, you have a password for it. So, and you decide what gets shown to them. So they can go to that website and they can, like, say, they'll go on their phone at the emergency scene, go to your website, type in your password, and then they can click, say, oh, she has mast cell activation. I don't know what that is, so they'll click on it. And you can put it in, like, the order that you want them to see it. So if that's the most important thing that you want them to see, this is so important for us because for so many years, we haven't had anything like this available to us. I mean, we're like, how do we fit all these things onto our medical bracelets? And even if we fit them on there, like, they're not going to know what it is. I can also print PDFs. I can also have other share cards. I can have a card that I can have for my primary care doctor. So we're just finishing up here, but I did want to talk about drug metabolism really, really quickly. So a lot of people with EDS have problems with metabolizing medications. So in addition to having allergies to medications, we also have metabolism problems. And it's really important to understand the difference between allergies and drug metabolism, because if you're not familiar with either one, it gets so confusing. I mean, we get to my allergy list at the doctor's office and they're like, okay, do you have any new allergies? Because it's so long. And I'm like, you know what, that's really kind of not even important anymore. Why don't you just say, like, I'm just allergic to everything? Because I have a mast cell disorder. It just depends on the day, you know, how many things I've already encountered before I got to that point. But we can get drug metabolism testing. There's a website called GeneSight. There's also a thing called the Flat Card Table that's put out by the Indiana University. There's a link here. There's also a link on our website. And I want to point out, we really, really appreciate your feedback. I believe we have presentation survey in paper up there at the front table there, or we have a link on our website for you to use. other things that I do or that you could do, keeping a journal, figuring out what your triggers are. So for me, if I don't get enough sleep, or if I eat additives, preservatives, I know I'm going to feel like crap. I know that for sure. Even if you don't have a diagnosis of mast cell activation, make sure your doctors write these symptoms down. Because maybe in a year from now, they're going to learn about it. And you want this stuff in your record. If you have a rash, make sure they know about it and they write it down. If you have a runny nose, if you have swollen hands, whatever it is, if you have IBS symptoms, make sure it's in your record. Because even if that doctor's not going to help you, maybe the next doctor can. Maybe when the research comes out, you know, it will be there. That's super important. Try to eat foods with the least amount of ingredients. Choose how you fill your bucket. Learn about it. Raise awareness. Be you and your family's own best advocate. Just because a medical professional says that you're not having that symptom or it's in your head, it doesn't mean that it's not real. Find a different doctor. Sometimes I have to trust my doctors more than I want to. We've all had trauma being at doctor's office. I mean, that's really an understatement, honestly. It can be so debilitating to think about going to a doctor's appointment and think that they're not going to believe you. You know, don't let them have power over you. Take control of yourself. You know, but then there are times that there are doctors that, you know, they've been to school, they know things that I don't know, and I know that. And sometimes I just have to trust them. Definitely see a psychiatrist and rule out psychiatric diagnosis. That's so important. So a lot of times people tell me, they just tell me to go to a psychiatrist. It's like, go. Because why? Because you want to rule these things out. You want to go back to that doctor and say, I was at the psychiatrist and they found nothing wrong with me. So stop blaming it on that. And even if they did find something with you, like, you know, it can help you, you know, because as we said, all those things, feelings can help trigger hormones and make everything worse. So here's a big thank you to everybody. And I will ask if anyone has questions. Yes.
I was just going to say with the mast cell, something, but there are certain medications you should avoid before testing.
Mm-hmm.
So they may not tell you that.
Mm-hmm. Right. I mean, I feel like whenever they have asked me to come in for that kind of testing, they've been clear that I shouldn't be taking antihistamines and stuff like that. So, did I ask you? Did I answer your question?
Tammy, can you repeat the question so we can hear it?
Oh, Stacey was talking about how when we go in to get testing, like the 24-hour urine and stuff like that, how we should be avoiding taking certain medications beforehand. Yeah, and a big problem with like the 24-hour urine testing is, you know, Dr. Malin said this so many times in her presentations, you know, all it takes is for one person to leave that urine sitting on the counter for 5 minutes for the temperature to change enough that now once it gets to its destination, that the test is negative. I mean, negative testing happens all the time. It doesn't mean that you don't have mast cell activation, just...
How did you figure out which foods triggered you? Was it like a food allergy test, or was it just kind of food diary and keeping track of that?
Okay, so the question is, how did I figure out which foods were my worst triggers. And that's actually a really good question. In 2012, I believe it was, I was pretty much bedbound. I had severe migraines. So in the back of my neck, like it was hard to lift my head. I had that base of the head stabbing pain, and like everything hurt in my neck. It hurt to lift my head. A lot of times it's what I hear people describing as Chiari, and craniocervical instability. I also had ribs that were spasming pretty much all the time. From when I was 16 till I was 32, I mean, it's like the stabbing in my ribs. It was awful. I remember I was hospitalized with the migraine and the neck problems, and I mean, it's scary to not be able to move or to feel like you're being stabbed. And I remember being at the hospital, and like it was still getting worse, and they're like giving me this, giving me that. And I remember my family came in, and they had brought me, I was drinking Propel water, 0 calories, aspartame. I chewed gum, aspartame. I mean, simple things like this. And then you just get rid of it. And, you know, going back to the basics, you know, there's an elimination diet out there. You can try that to see. But I think, you know, our bodies probably know something. Like, we should not be eating MSG and additives and preservatives and, you know, all those kinds of crap that's in everything. Anything else?
Is there a website to go to for the elimination diet that some people try?
I'm not really sure. I know that, is anyone familiar with that?
I don't know if there's a website, but there's the paleo that you can Google. Wheat belly diet, that's a lot of elimination. Karen Hurd, H-U-R-D, she's from Wisconsin. She basically cured my IBS, and I recommend her principles, her instruction to anybody. I don't think that's on my website. We do have
heard about her, like from other doctors.
Yeah, I would recommend her book, And They Said It Wasn't Possible, is the name of her book, And They Said It Wasn't Possible.
The Impossible. Hey, Jules, can you get that on our website too?
Yeah. There's also the Whole30. That's an elimination diet.
Can you repeat the name of the book?
And They Said It Wasn't Possible.
Okay, thank you.
That's the whole name of it. And she has a website. And the other book is The Walls Protocol, WAHL''S protocol. I know that was recommended by one of our doctors that treats EDS, Dr. Lamps. She highly recommends that book and that protocol. I'm reading that right now. Whole30 is a lot like the Walls Protocol, but Walls Protocol explains more of the mitochondria and the cell growth and cell death, promoting proper cell. I highly recommend it. So,
What's her name? Kate Hurd or Karen Hurd?
Karen Hurd. Karen Hurd. H-U-R-D, and then and it's a cheap paperback book. You can get it, I believe you can order it from Barnes and Noble. I'm sure you can get it from Amazon, and they have it in the La Crosse area library system, which I would recommend if we have any books to get those in the library systems within the communities. That way they can easily be checked in and checked out, and then you can share them with your doctors and so forth.
Awesome.
So.
Awesome. Thank you, Myra.
Yep.
So we do have references from this presentation on our website. And if there's anything else you need, you can always email me. So I guess that's it. I think it's super awesome. Can we, can the different groups say hi to everybody here? Like, can we do that? Yeah, did I spell it wrong?
No, they're all the groups.
Cool, hi.
Hey, everybody.
Hello, everyone.
Shelly and Ange, I see you. Say hi.
Hello. Hello. Hi.
Hey, Haley, get in here.
All right, let's all get together over here. Come on, get closer. Oh, there we go.
We're in the middle.
Patience with this because I made a post this morning. Okay, so I ordered from La Crosse to Wausau, Wausau to here, and actually the libraries in our actual location, 133 miles, 136 miles, 139 miles.
Oh, wow. Oh, wow.
Almost exact. And if you look at how many square miles.
All three locations they're broadcasting in right now.
I mean, we just really appreciate that everybody's had the patience with this because, I mean, with all the, everything we've dealt with
Tammy, you're a little far away from the mic. We can't hear you anymore.
hopefully in the future, we can, well, you can put on them. Hopefully in the future, we can have more groups like this and just get the education out across the state. Like they were talking about with that Project Echo, if we can get our groups together, that would be awesome. I mean, we need to get this education out there, whether it's EDS, Mast Cell, you know, dysautonomia, whatever it is. Angie, I can't hear you.
Yes.
Hi.
Hello. I'm actually on Shelly's because mine's muted. Can you hear now?
Okay, wave and say who you are.
I'm Angela Brown, Wausau. Shelly Vanderweerd, Wausau.
Who else is there?
Barbara Gehring, Wausau.
Hi, Barbara.
Andy Dunn, Wausau.
Oh, there you are, Andy. Hi. Awesome. You guys want to introduce yourselves at all? No?
Well, I'm Gelos. I'm here. Here's Panda.
Hi, Gelos.
Hi.
Panda.
Well, thanks for coming. You guys want to hang out? You are welcome to. Don't forget to give me some feedback.
Did you go?
Okay, thank you.
Thank you all so much. Take care.
Thank you very much.
Thanks. Bye.
Have a nice day.